This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. In this video, let me take you through a couple of cases where I'll be demonstrating the classical stop and chop technique. This video is aimed primarily at beginner surgeons, and I get a lot of messages saying that they find it difficult to do surgeries in these soft cataracts. Let me take you through these two cases where the nucleus is relatively softer, and let's see how the step-by-step maneuvers done during stop and chop technique. So I'll be beginning the surgery after the rhexis and the hydrodissections are done. Now we're ready to emulsify the nucleus. The first step obviously is to remove the superficial epinucleus in the cortex, which lays the underlying nucleus pair. To do this, these are the settings. The Phaco power is just kept at 5%, continuous torsional, and we have got a moderate vacuum and flow rate. So once the overlying cortex in the vacuum is aspirated, now is the time to perform the trench. Now this nucleus is grade 1 plus nucleus. That is what my assumption is. In these cataracts, sometimes it might be tricky to split the nucleus into two halves, and these are the sort of cataracts which most trainee surgeons would take. So when a trainee surgeon is dealing with a soft cataract, two steps are very critical. We need to have a slightly bigger rhexis, 5.5 mm or more, and we should have a perfect hydrodissection. So hydro procedure is extremely important along with the bigger size rhexis. Of course, there is always an option of doing hydrodelineation, and if you can do it, that's fine. But only then again you are left with an epinucleus which again needs to be managed. In this case, I have not done hydrodelineation. Only hydrodissection is performed, and my goal is to now create a long, thin trench. Sometimes we may end up having a very wide trench, especially in these ultra soft cataracts. So one trick which I am using to train my trainees is to expose the tip a little bit longer so that the width of the trench is just proportional to the tip. You don't have to include the sleeve to adjust for the width of the trench. So you can see the tip is slightly exposed more. My left hand is going to stabilize the nucleus, and you can see the settings which are kept. 50 is the torsional power which I'm using, only torsional, and the machine is Legion. The tip we're using is a balanced tip. The vacuum and the flow rate are extremely low. 12 is the flow rate and vacuum is 80. So you can see from one end of the rhexis to the other end of the rhexis, a single narrow trench is created. Now because the width of the trench is just the width of the tip, the trench width remains normal. And if you're going to include the width of the sleeve as well, then it's going to be slightly wider. And in these soft cataracts, a very wide trench can be detrimental. So that's one trick of this, of using a slightly bigger tip. The nucleus is rotated, a couple of more trenches. We just 3 trenches and we are through to the appropriate depth. In this eye, I think 50% depth is more than enough. Now, where do we keep the two instruments before doing lateral separation? They have to literally touch the posterior plate at the bottom of the trench, and then they're removed laterally. And because the posterior plate is very thin and easy to break, you don't require a lot of pressure. Just a little bit of lateral separation breaks the nucleus nicely into two halves. Let me pause here and go back to the previous clip. I just want to talk a little bit about how much deep should we trench in softer cataracts. Now remember, the lens thickness varies based on the density. A denser cataract is going to be much more bulky. The nucleus thickness is going to be larger. Whereas this case, which is just about grade 1, the nucleus thickness is also going to be very less. In these softer cataracts, you can just go 2 or 3 times. That should be enough. A 50% thickness trench, even in these thinner lenses, is also good enough to crack, because the posterior plate is not very leathery and it just gives way very easily. So how much of a depth of a trench to create also should be estimated before we go in. Denser the nucleus, thicker is the lens, and we need to go much more deeper. Whereas softer the lens, the thickness of the lens also is less, and you don't have to go deeper as well, as the posterior plate is very brittle and breaks very easily. So now we have got 2 heminucleus, and because the nucleus is very soft, I don't intend to divide into 3 parts which I typically do. I'm just going to divide into 2 parts. Again, the challenge is to get a grip, because the nucleus is going to melt as soon as I try to use Phaco power to bury the tip into the substance of the nucleus. I've kept the power of longitudinal energy just 10, and let me try whether I can get a good bury in here. I'm just trying to use very little power. You can see in my left hand top corner, because the grip is not great, the moment the chopper goes down, the grip is lost. But nevertheless, the nucleus is so brittle that even with a little movement, it just divides into two halves. Again, as you can see, it's using no power at all, just by vacuum. I'm trying to hold, but still the nucleus melts. Even with whatever little grip you have, you can just stroke your chopper down and then do lateral separation. Usually it will be successful. This is not a very sticky or crumbly cataract, so it broke quite nicely into 4 fragments. Now is the time to pull each of them out of the bag and then emulsify. This is probably the easier step. Again, if you're using just torsional energy, you might find it difficult to grab it and pull it out of the bag. So in that situation, maybe you can switch to longitudinal energy only to grasp it and pull it out of the bag. Once it's out of the bag, we can either emulsify with just longitudinal energy or the typical settings of a quadrant removal, which would be using just the torsional energy. And in this case, we have set the maximum torsional energy as 30%, and that is more than enough. So quadrant removal is relatively easy and it happens in a jiffy. Now let me take you through another case. This is a slightly denser nucleus. It's around grade 3. Again, we have a decently sized rhexis. Let me begin by doing the trench here. The nucleus is stabilized with my left instrument. The power is again set to about 60%, and the tip of the needle moves from the subincisional tip of the end of the rhexis to the opposite edge of the rhexis. And then progressively the trench is deepened. Now, because this is a slightly denser nucleus, I also expect it to be slightly more thicker, and I need to go a little bit deep. Maybe I've gone 4 or 5 trenches more. The nucleus is rotated, and I just go ahead and give a couple of more trenches. Remember, at this stage, the nucleus is a biconvex structure, and the nucleus is thickest at its posterior pole. It suggests that the trench has to be deepest at the central 3 mm area compared to at both the poles. Now, how do we know that this depth is good enough in this slightly denser nucleus? So let me zoom in and show you. There are subtle areas of enhanced red glow underneath these horizontal striations, which you can see. There are a couple of them at the peripheral edge and one in the center. And so these areas of enhanced red glow are reasonably good evidence that this much depth might be good enough to crack this nucleus into 2 halves. The 2 instruments are placed in the bottom of the trench. They're literally grazing against the floor of the trench. And then 2 instruments are moved laterally, and we have got a good crack. The nucleus is rotated 180 degrees and the crack is completed on either end. So now is the time to go ahead and divide the nucleus. Again, as is customary, my settings usually for chopping would include just the longitudinal energy. And let me freeze here and take you through the settings. The longitudinal energy just is 20%. I'm not going to use any torsional energy, and the flow rate is about 30, vacuum is 600. So the tip is buried into the substance of the nucleus, and because the power is in an interrupted delivery stage, I'm not going to use the entire energy at a single stage. So the tip is buried and the chopper goes down, and then lateral separation happens. As the next fragment is being chopped, let me slow down the video film and just go through the changes. So during the burying part, the energy is being used, and once the burying is completed, the foot pedal is only in position 2 and there is no energy being used. It's only held in vacuum, and then the chopper goes down vertically and then laterally for the split to happen. Most beginners make a mistake that the Phaco power will still be on when the chopping maneuver is being done. What it does, it loses the grip and we lose the vacuum seal, and we end up having an inefficient or incomplete chop. So this one practice has to be maintained, that you are going to use the power just to bury it. Once the burying is done, as the chopping maneuver is being done, you need to be in purely at foot position 2 using just the vacuum to hold lens. So once both the heminucleus are divided, so we have got 6 smaller fragments, and now we are going to change the settings to the quadrant removal mode, where I'm going to use just the torsional energy to emulsify it. So you go ahead, bring the nucleus out of the bag and then emulsify. What I've observed among all the trainee surgeons which I've been training, the common step where most trainees are good at is the quadrant removal, because there is not much confusion. There's less of an involvement of the non-dominant hand, and only one hand is going to do the job, and the phaco energy is being delivered through your foot pedal. So this is probably the most easiest step as far as nucleus management is concerned for a beginner surgeon. So all the 4 quadrants are emulsified, the lens is placed into the bag, and that's it, the case is done. To summarize, this was a brief overview of the stop and chop technique for the trainees, and we touched upon the principles and also some of the settings which can be used during these procedures. So thank you for watching and hope you found this helpful.